Good morning, everyone, and thank you so much for joining us this morning as we celebrate children's health and share an amazing announcement from the Environmental Protection Agency for Johns Hopkins University School of Medicine to support their children's health research. I want to welcome Senator Ben Cardin, U.S. Senator who has been an amazing advocate for health in Baltimore, understanding that we have serious disparity issues. You've always been right there, and I want to thank you for that. And I want to welcome back to Baltimore. I think you were here like less than 2 weeks ago, and it's always great to have EPA Regional Administrator Sean Garvin here, who has been a friend of my administration from my earliest days. I'm grateful to have him here because I say all the time, barely 2 weeks passed that the Obama administration, in some form or fashion, is not here. Like they're here all of the time, and they're here in a way that supports the growth of our city and supports the things that we hold dear. Whether it's public safety, education, health. The Obama administration is always here, so I'm very grateful to have you here, Sean. Dr. Christopher Weiss, National Institute of Environmental Health, and Dr. Nadia Hansel, Johns Hopkins University School of Medicine, and the Hopkins team. So I want to thank you all for being here. Improving the quality of children's health has been a priority of my administration from day one. It was, I was raised by a pediatrician, so the thought that children's health is a priority should come to a surprise, should be a surprise to no one. And this month, we celebrate Children's Health Month, and this week, we pause to recognize National Lead Poisoning Prevention Week. I'm very proud to say that childhood lead poisoning in Baltimore City has declined by 98% since 1993. Our health department has been working very hard to have inspectors randomly test children's jewelry for lead, and nearly 50 violation notices have been issued. I want to recognize in the audience with us today, this morning, is Ruth Ann Norton, President and CEO of the Green and Healthy Home Initiative. Thank you very much, Ruth Ann. It is the leading healthy homes organization in the country. Ruth Ann's organization was awarded the EPA Asthma Leadership Award in 2015. As many of you know, asthma is the #1 cause of children missing school. So I want to thank you, Ruth Ann. Because of your work, we have children who are on target and on pace because they have their asthma under control. And when that happens, we know that they're on target for life. So thank you for the work that you have been doing. I'm also excited to recognize the young people from the Living Classroom. Thank you all for being here. Beautiful young people today. I know that you would much rather be in class right now, but I appreciate you taking just a little bit of time to be with us. So we've reached numerous exciting benchmarks in regard to children's health, including as many as 10,000 elementary and middle school students in Baltimore City lack the glasses that they need. And earlier this year, Baltimore City convened partners from across the country to form Vision for Baltimore, a program that will eliminate barriers to care and provide high-quality vision services to every student in pre-K through 8th grade over the next 3 years. The city's infant mortality rate has declined 38% since 2009 to a record low in 2015. Also in 2015, Baltimore City school health suites, where children can go during school hours to get medical attention, received almost 300,000 student visits. And last month, Baltimore City Schools, in collaboration with BHCD, received $2.3 million in federal grants from the Department of Education to promote student resilience. We have a lot to celebrate today. And I also want to announce a great event that is taking place next month, a health fair about children's health, workshops on topics such as asthma, environmental justice, healthy homes, lead poisoning prevention, as well as healthy snacks. This will be presented in partnership with the City of Baltimore, the EPA, HUD, and Morgan State University from October 29th from 10 a.m. to 2 p.m. at Morgan State University. Please mark your calendars. So it is now my pleasure, after hearing all of that great news and good things that are coming up, to introduce someone who, as I said before, You know, I loved when I got to say my friend Ben, but you're really Baltimore's friend, Ben, and that's Senator Ben Cardin.
Thank you very much. Thank you much. Well, first to Mayor Stephanie Rawlings-Blake, congratulations on your extraordinary leadership here in Baltimore. We're very proud of what you have been able to do. Your priorities are our priorities. And today, you're underscoring that today with our children and children's health. There is no more important investment for us to make, and I'm going to talk a little bit about that. But you've been there for all the issues of Baltimore, and we very much appreciate your extraordinary leadership during extremely difficult times. And to Sean Garvin at the EPA Regional Administrator, thank you. You've been here, we've been together a couple times this week. You've been here regularly. The Obama administration has paid attention to our cities. They've been here numerous times looking for creative ways in which they can help deal with the problems of Baltimore and our cities. They've done that in education, they've done that in law enforcement, they've done that in environmental issues, and they're doing it today in health and environmental issues. So thank you. Thank you, Sean, if you will relay that to the President. I appreciate it. Let him know how much we appreciate his extraordinary leadership during a time in which, quite frankly, it's been tough to get funds. It's been a very difficult period in our fiscal issues to deal with using and getting additional funds. But what you've been able to do is use the funds that you have in a creative way and leverage them to get the maximum results. And I am proud of our congressional delegation. We have been focused, working with the Obama administration in order to help Baltimore and to help our state. So I do want to thank Senator Mikulski, Congressman Cummings, Congressman Sarbanes, Congressman Ruppersberger. We've worked together as a team, and today's announcement is part of that team. So let me just talk a moment about children's health. This is Children's Health Month. Children are, of course, should be our number one priority, and they are our number one priority. They're our future. In healthcare, children actually are less expensive than older people. So we don't need to spend as much money on children as we do because of their healthcare needs are not as complicated. But they are more vulnerable. They're more vulnerable to environmental risks. If we have a bad ozone day, children are going to suffer. Their asthma will be much worse. We know that. Children are more vulnerable to lead. We know that. We know that they can't tolerate any lead. You all know what the acceptable level of lead is in water? Zero. Ruth Ann, thank you for all your work over so many years that we've led here in Maryland, giving a model for the nation on how to deal with lead poisoning issues. And we've made a major, we're an older city. We know that. One of the oldest cities in America. So we understand that. So we have the issues of lead. And we have we have provided the leadership to deal with that issue. So when you invest money in children, you're going to get a great return. And that's what you're doing with this grant. And we thank you very much. You're investing in our children, which will make an incredible difference in their lives and in the future of America. So let me just talk a moment about some of the things that we are doing. I've mentioned lead. We have a Water Resources Development Act that's passed the United States Senate. And we're hoping to get it done in the session after, the lame duck session after the elections. Get it done this year. And in amendments that I offered, adopted unanimously, this is not partisan, will provide new tools to deal with lead poisoning. New tools. Baltimore is not Flint, Michigan. The water system in our city is safe, but the connections to some homes, the connections to our schools are not safe. That's that last mile of connection that contains lead in the pipes. We need to change that. We should be able to use our water fountains in our schools. This bill provides those resources to do it, and I am hopeful we'll be able to get that done. So as we are dealing with Lead Poisoning Prevention Week, let's urge the Congress to get this job done this year to give you the tools you need to deal with lead poisoning in our community. I was with Sean just last week as we looked at ways in which we can reduce diesel emissions to deal with ozone problems. Children are the most vulnerable. Living Classrooms understands that. You're outdoors. You understand what a healthy environment's all about. A healthy environment means we'll have healthier children and we'll have a better future. And today, we celebrate the brilliance we have in our academic centers at Johns Hopkins. We thank you very much for your commitment to dealing with connecting the dots. We know that there are things we can do to stay healthier. Obesity, we know that issue. What is its relationship to asthma? Our gut tells us there's a relationship here. We need to know the facts and how we can connect the dots to keep our children healthier. That's what this grant today will allow us to be able to do. Connect the dots to keep our children healthier so we all can have a brighter future. I'm very proud to be part of this team, and I thank you very much for everything you're doing for our children.
Thank you very much, Senator. I'd now like to invite, as I mentioned before, a friend of Baltimore City, our EPA Regional Administrator, Sean Garvin, followed by Dr. Christopher Weiss, and then Dr. Nadia Hansen. Thank you.
Well, one, it's always tough to follow Senator Cardin when he speaks because of his passion, his drive, his leadership, not only here in Baltimore, here in Maryland, but really throughout the country, both on environment, on the Chesapeake Bay, but really in the lives of our families. So thank you very much for all your leadership. Madam Mayor, it is a distinct pleasure to be back in the city of Baltimore. I think with this event, you have surpassed any mayor that I've done any events with throughout my career. So, and there's a very good reason for that. It's because of all the great things that are going on in the city of Baltimore under your leadership, and it really has been a pleasure working with you. I don't know if this is the last event we're going to do before we both leave our current jobs, but I do want to take this time to thank you on behalf of the EPA, thank you on behalf of the environment and public health, and really thank you on behalf of the citizens of Baltimore. Your leadership has resonated outside of just the boundaries of this city, and I greatly appreciate it through your work as, the National Association of Mayors and other things that you have just been a huge advocate, and I can't thank you enough. To Dr. Weiss and your partnership, and Dr. Hansel, your partnerships, thank you very much for being here and joining with us to really undertake the great things that we're doing and really the announcement that we're here for today. And I do need to make sure it's clear that I wouldn't be able to be here if it wasn't for the leadership of Senator Cardin, Senator Mikulski, and the congressional representatives in Maryland. Only time I can announce funding is when we have the support of Congress to actually have that funding to give. So thank you very much. But the real reason we're here are these students that are standing beside us. I was talking to them right before this, and I can tell you, one, I could switch with any of you and you could come up here and do this. These are some of the sharpest kids that I ever met, and when often talking about the environment and talking about our students, they're often referred to as the next generation of environmental stewards. I made it very clear to them this morning that they are our current environmental stewards. They're the ones that force us to do what we do, one, in protecting them, but also in our homes. They're the ones that come home. We would not have curbside recycling in most places throughout the country if it wasn't for our students coming home saying, you can't throw that out, you got to recycle that. And so us as adults went, well, let's make it as easy as possible. Let's have curbside recycling. So thank you for what you do, and it's a pleasure for me to be here. As has been mentioned, October is designated as Children's Health Month, and children are the central to EPA's policies, programs, and activities all year round. At EPA, every day is Children's Health Day. Because everyone has a right to clean air to breathe, safe water to drink, and healthy land to call our home, it's about environmental justice. The most basic part of EJ is our children. EPA has celebrated Children's Health Month since October 2001, developing educational materials and activities that highlight the importance of protecting children from environmental risks. This year's theme is Healthy Communities, Healthy Children. In his presidential proclamation for Child Health Day 2016, President Obama said, quote, "Securing a bright future for Americans' daughters and sons requires us to continue expanding access to quality health care and working to foster cleaner, safer, and more supportive environments." We know that children interact with the environment differently than adults. They eat, drink, and breathe more than adults do in proportion to their body weight, and they spend more time outdoors. Therefore, they are more likely to be vulnerable to the effects of environmental contamination when playing and crawling, as they are constantly putting their hands in their mouths. Probably not you guys, but as grown-ups, health professionals, parents, teachers, and regulators, we need to be vigilant, protecting our children from these risks. This is why the National Institute of Environmental Health Sciences joined with EPA to establish Children's Environmental Health and Disease Prevention Research Centers to explore ways to reduce children's health risks from environmental factors. Since 1998, NIEHS and EPA have jointly funded centers which combine community engagement with scientific research. These children's centers have published more than 2,400 peer-reviewed publications and have helped establish the foundation of children's environmental health research in the United States, promoting health and well-being in our communities where some of our nation's most vulnerable children live, learn, and play. I am pleased to announce today that EPA and the National Institute of Environmental Health Sciences are awarding a $6 million grant to the Johns Hopkins Center for the study of childhood asthma in the urban environmental area here in Baltimore. Now, just if we're going to... Just to get the math right, so this year, now our total going to Johns Hopkins is up to $17 million. And since 1998, a total of $300 million has been contributed to centers throughout the country. So a lot of great work can come from that. And so thank you, Dr. Weiss and Dr. Hansel. The research at Johns Hopkins will focus on childhood asthma in Baltimore. It'll be investigating obesity as a contributing factor to asthma and use its findings to inform appropriate interventions to improve the health of those children most at risk for pediatric asthma. This work by Johns Hopkins continues a long and valued history of research assisting EPA and NIEHS in studying environmental challenges. And as the Senator and the Mayor had mentioned, in addition to its celebrating Children's Health Month during October, this past Sunday marked the start of Lead Poisoning Prevention Week. We know that lead is particularly dangerous to children because their growing bodies absorb more lead than adults do, and their brains and nervous systems are more sensitive to the damaging effects of lead. The long-term effects of lead in a child can be severe. They include learning disabilities, decreasing growth, hyperactivity, impaired hearing, and even brain damage. While EPA and the Maryland Department of the Environment have taken regulatory steps aimed at preventing lead poisoning, many children living in older homes in Baltimore remain at risk. We recommend that children who live or have lived in homes built before 1978 get tested for elevated blood lead levels. Now, as the Mayor also mentioned, I want to encourage all of you to attend Children's Health Month event coming up this weekend. The Baltimore Children's Health Fair, Healthy Communities, Healthy Children, is happening this Saturday, October 29th from 10 a.m. to 2 p.m. at the campus of Morgan State University. The health fair will also include information and resources on topics such as asthma, pesticide, lead poisoning prevention, chemical safety, healthy homes, children's environmental health research, sickle cell, fire and safety, and much more. At the end of the day, we need to remember that there are more than 130,000 children in Baltimore City who need us to be continually vigilant to ensure that they have clean air to breathe, clean water to drink, safe food to eat, and healthy environments to learn, grow, and thrive. While EPA can research the risk of exposure and regulate accordingly, parents and caregivers can also take simple steps in the everyday environments of children that will promote healthy growth and development. By working together as partners, not just in October, but throughout the year, we can take significant steps to promote healthy environments, creating healthy communities and healthy children. Again, I'm pleased that we're able to award this $6 million grant by EPA and the NIEHS to Johns Hopkins. and will help to improve lives of children with asthma. Thank you very much.
Thank you very much, Administrator Garvin, and Mayor, Senator Cardin, thank you very much for the opportunity to be here today, and especially thanks to the young folks that joined us today. It's all about you. Where we go in the future is up to you folks, so take us there. Many people don't realize that about a quarter of human disease is associated with our environment. It's attributable to our environment. For kids, as Senator Cardin mentioned, that fraction is even greater. Almost 40% of childhood disease is associated and attributable to their environment. That's why at NIEHS, it's our strategy, our priority, and in fact, our passion to understand the effects of environmental exposures on children's health and development. And we're so glad to have the partnership that we have with EPA and Johns Hopkins to help us in this effort. I speak for our director, Dr. Linda Birnbaum, who indeed has made this one of her most important goals and strategies, and it's certainly her passion, I can tell you that. Together, NIEHS and EPA support more than 20 children's health centers nationwide with highly competitive awards. People who obtain these awards work very, very hard for them, and they're very highly competitive. The folks that win these awards are the best of the best. Since 1998, this work has resulted in the publication of more than 2,400 scientific papers on children's health, as Regional Administrator Garvin just mentioned. At Johns Hopkins, we're thrilled to have a long-standing program of research in children's health. NIEHS is proud to be able to contribute to the health of the children in Baltimore, you folks, and every American city, thanks to the persistence and the tenacity of the researchers who we are able to fund. And I want to shout out a few of those people that are here at Johns Hopkins. Dr. Nadia Hansel, who's with us today, thank you so much for your passion and your work. And her colleagues, Greg Diet, who's also a longstanding member and a funded scientist in this program, and Elizabeth Matsui, who's now moved on from the program to other things, but was foundational in this effort. So we especially thank them for their work in urban air, for their community involvement. These folks are always out in the city. Get to know Nadia. She might be knocking on your door sometime. So they're constantly doing community outreach and especially working on air pollution and asthma, which, as it's been mentioned, is so important for children's health and growing up. So with that, Nadia, you were going to say a few words. Can you explain some of your work for us?
And thank you very much. It is really a pleasure to be here today, and thank you to everyone here. It really is a partnership. The NIH, the EPA has supported our work for several years now. And we are all committed to improving the health of children in Baltimore. Asthma, 1 in 5 children in Baltimore City have asthma, which is well above the national average. And so our work, our team, and it truly is a team of investigators from multiple disciplines, including pulmonologists, environmental health specialists, pediatricians, biostatisticians, are working together to try to understand what are these environmental exposures that are causing such a high prevalence of asthma in our children. We want our children alive tomorrow. We want them in their schools today learning and trying to understand the environment. So we all know, it's well shown in many studies, that outdoor air pollution and all of the great work done by the NIEHS and EPA is important in terms of driving some of this asthma prevalence. But it's not only what's outdoor, it's what's inside our homes with children with asthma. And what our group is really committed to is going in homes through partnership with families in the Baltimore community and trying to understand what it is in the environment that affects the high asthma prevalence and the high risk that our children have of being admitted to the hospital for an asthma exacerbation. And what do we know? Well, we know that if kids are allergic and they're exposed to these furry animals that they might be allergic to, that they have a higher risk of hospitalization. But that's not enough. There are a lot of other complex exposures that affect that. And while we tell our kids on high pollution days or high ozone days to come inside and avoid the outdoors, what we've discovered is that unfortunately the air inside these homes are often worse than the air that's outside. Whether it's smoking or other exposures, the air quality inside our homes are often worse than what's outside. And the one thing we can do is that we can actually do something about the indoor air, and that's one of the things that our group is committed to. So the higher dust levels, gases that is coming from stoves, gas-fueled stoves or heaters can all contribute to the worse air that our kids breathe that bring them into the hospital. Further from our work, as it has been mentioned, we know or we feel as found through some studies that childhood obesity, which is also an increasing problem in the United States in general, is probably coming into play with the environment, and that the environment might be worse in children with obesity. And our work today in our new program is trying to answer the questions of what about obesity is making us, predisposing us to our environment. And can we improve the environment? Our work is going to lead to strategies to improve the air quality and hopefully improve asthma health in children. And as mentioned, it's a partnership not only with the NIH and EPA, with the Baltimore families and Baltimore community, and we hope to continue to do, through the funding that we receive, a lot of outreach work to reach the families and educate and work together to understand what are feasible home interventions so that we can improve the environment and improve the health of our children. So I want to thank you all for supporting us and for allowing this work to continue. And I look forward to speaking with you all and continuing to work with the children in our community. Thank you very much.
Again, I want to thank Dr. Nadia Hansel, Dr. Weiss, Administrator Garvin, Senator Cardin. I also want to thank Kristen Rezkowski, Chief of Staff in the Health Department. I want to thank my Deputy Mayor, Don Kierstetter, and the head of the Living Classrooms Foundation that was so kind to work with us and bring these young people here, James Piper Bond. So again, thank you all and congratulations.